My past experiences with chiropractors have been underwhelming. A quick crack, in and out, and not much change. But Colorado Sports Chiropractic, totally different story. Dr. John Minen isn't just any chiropractor. He's an Olympic trials runner and delivers full body performance work for elite and everyday athletes alike.
What is sports chiropractic? And in my book, it's a blend of all the professions together. So having, the orthopedic diagnosis and assessment combined with, osseous manipulation, which most people just associate with chiropractic, combined with soft tissue modalities, as well as corrective exercise specialties. So you put it all together.
One-stop shop.
One-stop shop.
After a quick tour, we jumped into an assessment. I told John about some of the tightness I feel in my stride and back while sprinting. He checked my hip flexors, low back, and rotation, instantly spotting some limitations.
All right, so we've got right side hip flexor, left side QL. We haven't looked at the neck yet, but I think we'll start with this first, right? And then we'll come back up and take a look at the neck.
Okay. We started with active release on my low back.
So a lot of the stuff that I blend, we're kind of getting into like level 2 ART moves.
I've never had someone pin the tissue like that while I twisted. It instantly freed up my movement.
Was that your neck?
Yeah.
I heard that. The first, I think you had some tension down here.
You're on the right track.
We found some stuff. The second level courses are basically looking at how the two tissues differentiate between each other. And the first level is going to be more so how you can pin and stretch a single muscle.
Pain and restriction I walked in with, already improving.
Yeah, I really like the movement and soft tissue work at the same time.
Yeah. You coming back? There we go. There he is.
Back for emotional support.
Uh-huh.
Thank God. From there, he attacked the lats, clearly working on my rotation through the spine.
So
I almost feel like through here.
And you're pinching here?
Yeah.
So come out of it for a second. Let's do that again.
It's easy to forget how the lats tie into stride and performance, but he saw it right away.
So bring that elbow down. There we go. I'm going to come over to this side now. This is where we're just going to push the lat and the serratus apart. So I'm going to squeeze in here, grab the serratus muscle.
Okay.
You're going to have to go slow. Go ahead. Good.
Yeah, I haven't really had anybody do this kind of specific work on my low back, especially with the movement and pinning.
Next up, hips.
This leg is going to be the one we're going to be treating, so we'll have you slowly take the leg, straighten it out, and go back behind you, and we're going to be working in the front of the hip here. And this one can be a little difficult because it's a small guy. It's a little tiny muscle in the front of the hip.
You saying my hip flexors are small?
Yeah, you got little baby hip flexors here.
I feel attacked.
Do you even work out?
Do you even lift, bro?
Yeah. So a little bit in there. Straighten that leg, bring it back as far as you can. There we go. I'm just going to pin the hand here and help you stretch that back. Straighten the leg, drop the hip a bit. There you go. And squeeze the glute if you can. Your other glute. Good, come back. At the end of the day, you're like, hey, I got to do my stretching and mobility before I go to bed. You're not like sticking your hand in your gut. You're like, okay, I'm going to stretch my hamstrings and my hip, and it's the least easily accessible of the tissues, particularly if you just had dinner.
Right. Well, and nothing, that's part of my channel too, is like just nothing replaces an experienced, qualified practitioner helping you become aware of what's going on, you relaxing, them guiding you, their precision. I mean, you can do all this work to yourself, but it's never going to be like you doing the work,
I do everything that I would want done to myself. But the hard part is finding somebody else that could do that for you. I'm sure you probably have that same struggle.
Definitely.
And you're like, hey man, I really want you to do this thing.
Yeah, well, that's part of the Shadle's Table quest, I will say I've been pleasantly surprised, but I am like doing my research and be like, oh wow, this person's like you're really well known, and some of the other people I've seen have been really well known, but everyone's so unique in what they do, which is cool. It's like artistry, you know?
More active release and pin and stretch. This combo of manual work and movement is powerful. I could literally feel space being created in my joints.
I'm gonna
that's
hold
awesome. That feels good.
You feel that?
Yeah, it feels
so
really good.
Now this is actually kind of a neat move. I'm actually on.
Is that your hand or your elbow?
This is my hand.
Okay.
I'm on the iliolumbar ligament on the front side of it, right next to your psoas.
Okay.
And so they can get stuck together, particularly when you had, stuff going on in the lumbar spine and then contralateral rotation issues.
Yep.
Go ahead with that. Bring that back. I'm gonna hold that. There we go.
Yeah, I feel like I'm accessing more of my glutes now. It feels like.
Well, that's what I was joking when you first. I was like, use your glute.
Yeah.
And there was nothing happening.
Yeah. More glutes, more power, baby.
I think we got that.
Yeah.
Pretty cleared up.
Then it was time for the medieval tools, Graston. Stainless steel tools that scrape the fascia, helping everything glide and slide better. Wild sensation, but not as painful as it looks.
Every stroke that I'm using here is following lymphatic drainage and venous blood flow, because you don't want to damage the vessels, and you want to kind of get some of the metabolic waste out of the legs. We have regular scheduled visits to the dentist office and regular scheduled eye appointments, but nobody really regularly schedules body work, right? Unless they're like completely wrecked, and then they expect it to go away in a day. Just wiping you down.
All right.
Cool.
We talked about my neck surgery and nerve issues, and John ran a few tests, then more active release through the neck and arms. Honestly, it was fun. We were laughing while unwinding years of tension. Sometimes I'll do something weird where my arm will be out and head will be turned and I'm like, oh, I'll feel this thing still.
So it still goes down your arm?
Not really, but it's usually when I least expect it. So sometimes I have a hard time recreating it, which is good.
Yeah.
But
that's good for me because it makes it harder for me to figure it out.
yeah.
The hard part is that what heals the disc irritates the facet joints.
Right.
You had the osteoarthritis, which is facet joint jamming. And were you a wrestler?
No, but
Football?
I just
anything
think
like that?
from doing the massage, right?
Yeah.
Right. And then I did time trial.
Oh.
And then I swam.
It was
right?
probably
And
more
I-
time
and
trial
I
related then.
breathed, this way pretty much all that time. Yeah.
Yeah.
So.
We'll usually see that early onset osteoarthritis with either trauma to the neck or...
Yeah, osteoarthritis.
Yeah, you had OA.
I got it in my 30s.
Yep. Yep. I'm going to be working through all those facet joints, and we're going to roll in. We're actually going to do some intertransversarii rotatories, and then we're going to get into the scalenes.
You're throwing some big words around, bro.
Yeah, you like that? You're going to have to Google those later.
Yeah. I'm just going to upload it to ChatGPT. That'll be it.
Those are just slightly different angles. That's a spot. You should feel a nice deep stretch. Keep going all the way to the side. There we go. Kind of a difficult move because you have to roll the thumbs in, or roll the fingers in underneath. But once that puppy opens up, you should feel it quite a bit better. There we go.
How's my neck mobility feel?
It's not bad.
Yeah.
Yeah, you've definitely done a good job taking care of that. I'm gonna roll in right on the upper trap fibers now. You're gonna move the head all over to the side. I want you to slide that left arm down towards your foot.
Left arm down towards the foot.
Simon didn't say? I'm just kidding. You got it. Good. Last thing that we'll do is I'm gonna pin that muscle and you're gonna move. We're gonna add some nerve movement. Stretch out the facet joint. Go ahead. Move that arm for me. Good. Move that thumb, wrist, and finger back. Like that. Good. Now I'm going to add a little extra stretch. You should feel a pretty intense stretch there.
Feels good.
Yeah. And then let's do that one more time. Bring it all back. Roll that up. Okay, ready? Let's Let's do that again. Thumb, wrist, finger, all back.
Feels better this time.
And drop the arm more if you can. There you go, right there. Yeah, they're pretty powerful. It only takes like 1 or 2 moves and that starts to open up. So just a few moves here on the right side.
Jiu-jitsu moves?
Yeah. I call it Taekwondo. That's it, free it up.
Before the sensation, I couldn't bend forward without back pain. Now, gone. That immediate change tells you something. His system works. I definitely feel looser for sure. I feel my my
Glutes?
Yeah, I feel my glutes more.
Yeah.
Yeah, for sure.
I think that was the last thing that we hadn't gotten to just yet.
Yeah.
We didn't do too much glute work.
But yeah.
You want to stand?
Sure.
We'll have you bend down, touch your toes. Tell me what you feel that's different, if it's anything.
I don't feel the low back stuff. Yeah, I just feel like my hamstrings are sore, but I ran and I lifted hamstrings pretty hard yesterday. But I don't feel this anymore. It feels like smoother, less restricted.
Yeah, that doesn't feel tight right there. That's good. I like that.
Only after all that work did we get into the adjustments, and they felt earned. The tissue was open. The system was primed. It was the perfect finish.
So what we'll do, side posture position. Bottom leg will straighten out. Top leg hooks behind your knee. I'm going to slide your hips forward, just like that. I'll move you here. And this is going to go here. I'm going to untuck your shoulder a bit. And I want you to hold on like that. Okay, go. Now, let the hip drop, look over that shoulder. And there we go, just a little guy.
Yeah.
Okay, switch sides, we'll balance that out. All right, same thing. Inhale, exhale, look over that shoulder. Little guy, nice.
That was good.
I'm incredibly impressed with the care at Colorado Sports Chiropractic. Whether you're an elite athlete or someone chasing better health, this is how bodywork and chiropractic should be done.
Well, how you feeling?
I feel good, man. Thank you.
Cool.
That was awesome. I definitely feel way looser.
Well, next time
I guess you're good.
Yeah, all right, you're all right. Yeah.
No wonder we're still in business.
The next time you come in, we can focus more on the treatment and less on the big words.
Right. If you're on your own journey to move better, live better, or train like me in your 40s, hit subscribe. I've got more episodes like this coming.